Good afternoon. My name is Simon Franco, and I will be doing a video presentation on lifespan management, what it is, who it helps, and the general availability of resources. Now, S.J. Olshansky, professor in the School of Public Health at the University of Illinois, states, "What we know for sure from our work and from others is that mice have a lifespan of 1,000 days. Dogs have 5,000 days, and we humans have 29,000 days." Recognizing that the duration is limited and aging is inevitable, focus attention on enhancing the quality of the days you have. How powerful is that statement? Let that sink in. Now, according to longtermcare.gov, long-term care is a range of services and supports you may need to meet your personal care needs. Most long-term care is not medical care, but rather assistance with the basic personal tasks of every day, also known as activities of daily living, ADLs. ADLs focus on tasks such as dressing, bathing, and eating. In addition to assistance with the ADLs, other long-term care services provide assistance with instrumental activities of daily living, IADLs. IADLs focus on things such as housework, shopping, and taking care of pets. While many think that the primary population that is served by lifespan management would be the elderly, lifespan management can assist virtually anyone in any demographic. The Centers for Disease Control and Prevention stated a breakdown of three primary categories that tend to use lifespan management more. These three groups are those that are at risk for acute and chronic illnesses, those exposed to different chemicals in the environment, and those affected by a public health emergency. Within each of these three groups, demographics, health status, life expectancy, and socioeconomic factors impact availability and quality of care. Think rich, poor, think minority, and a public or a general race, so white, black, Hispanic, and how that all impacts the quality of care. Now, based in Phoenix, Arizona, many different services are offered depending on the many different factors. For example, because of the large tribal population that reside in Arizona, the Arizona Long-Term Care System Tribal Case Management Program is geared towards American Indians and the long-term care services that they specifically may need. Now, in addition to that, Phoenix is actually flooded with viable places of care that fall along the whole continuum of care. Now, for example, depending on the level of need, the spectrum of care ranges from aging in place to community housing models, assisted living, and skilled nursing facilities. Each level can offer hospice palliative care. Now, examples of care include organizations such as Encompass Home Health and Hospice that offer in-home health care services. Depending on the level of need, assisted living homes such as North Valley Assisted Living and Cornerstone Assisted Living offer services that allow independence for the patient while still being present in case of need arises with the ADLs or the IADLs. Now, transitioning from there, Morningstar at Arcadia, the Stratford Court, and Haven of Phoenix are all nursing homes that provide a greater level of need. All facilities are geared to be accommodating to those with mental and physical disabilities, as well as those who are elderly. Now, each of the aforementioned facilities vary in cost, and cost seems to be the biggest determining care that either the family or the patient themselves take into consideration. Probably the insurance that is most commonly known would be Medicare. Now, Medicare is available to anyone aged 65 and older, or any individual that is disabled and receiving STI. Medicare is also available to any individual that has an end-stage renal disease. Medicare has four components. Medicare Part A is known as hospital insurance, helps with the patient with costs associated with inpatient care, skilled nursing facilities, and hospice care. Medicare Part B is known as medical insurance. This is often associated with visits to one's own primary care physician, ambulances, services, and actually some medical equipment. Medicare Part C is known as Medicare Advantage. This is private insurance that is mandated to have the same level of coverage as Parts A and B, but tends to have additional services such as hearing, vision, dental included. This type of insurance often works as traditional insurance, meaning that the type of plan may have a deductible, co-pay, and premiums. Now, Medicare Part D offers prescription drug coverage. In most instances, an individual will have a secondary insurance in conjunction with Medicare Part A and B to help offset any additional costs that they may receive. Now, for those that may not qualify for Medicare, additional alternatives are offered. A patient has the option of paying for the services themselves. If the patient does not have the luxury of being able to afford services, the patient could have private insurance. This can be purchased either through an employer or through their own insurance broker or self. Medicaid is an alternative that is offered through both federal and state programs that assist with health insurance coverage for individuals based on income, family size, elderly, pregnant women, and those with disabilities. Medicaid actually offers its services to nearly 1 in 5 Americans. Now, lastly, individuals may be interested in seeking information about long-term care insurance. LTC insurance can help assist with costs associated with hospice, respite care, and nursing home stays. Long-term care insurance will either pay the maximum amount per day or total over a lifetime. It is important to note the importance of regulations have over healthcare. For example, the Centers for Medicare and Medicaid oversee the regulations related to Medicare, Medicaid, and state children's health insurance program. The CMS also ensures the compliance with HIPAA. Now, the most general reason for regulation would be to protect the patient from any sort of malpractice, negligence, or fraud. Peter Diamandis said, all over the world we're seeing access to food, clean water, education, and healthcare improve. As a result, global innovation is rising as well. When it comes to lifespan management, the United States is at its whole is at one of these points asking themselves, where do we go from here?